Broadcasting from the Cass Corridor in Detroit, this is The Metro. I'm Robin Vincent.
And I'm Tia Graham. Today on the program, electronic music lovers are gearing up to lose their minds on the dance floor for movement. But in a scene where drugs are common, how do you stay grounded?
Plus, public housing in America is often framed as a failed experiment. But who gets to write that history?
And in education, teachers carry the weight, day in and day out. This year, one Michigan educator is getting the spotlight he's earned.
Also, in Michigan, there are thousands of cases of missing and murdered Indigenous people. In a system built to forget them, Native families are demanding justice and visibility.
But first, May is Mental Health Awareness Month. In Wayne County, one of the foremost organizations trying to ease resident mental health burdens is the DWIHN Integrated Health Network. DWIHN works to address mental health problems facing residents, and they've been rolling out new services to address those issues. Last year, DWIHN began operating mobile mental health crisis services 24/7. That's in addition to later expanding mobile crisis unit services to children. And just last week, the organization announced they have a community outreach clinic to reach residents in Wayne County neighborhoods. To discuss this new service, we have Andrea Smith here with us. She serves as the Director of Innovation and Community Engagement for DWIHN. Director Smith, thanks for joining us.
Thank you for having us.
Of course. So this community outreach clinic is supposed to meet residents where they are in their own neighborhoods. Tell us about where that idea came from.
Sure. So the idea was born out of different projects and initiatives we had during the pandemic, the COVID pandemic. And we noticed that a lot of people were hesitant about seeking care. They didn't know where to go. They were afraid to go places. They didn't know if they could afford it. And so there was an opportunity through some funding at the federal level to come up with this idea called Beyond the Walls. And so Beyond the Walls supported our mobile crisis initiative that you mentioned. And then a portion of that was to provide outreach services as well. So it was trying to reduce barriers.
And the clinic has a bathroom and an exam room. What else is there, and what kinds of services can it provide residents?
Sure. So it's literally like a doctor's office on wheels. So if you walk into the clinic to the right, you can sit down at a table and have a one-on-one conversation or assessment with someone. You can get your weight checked if you're in that same space. If you go into the middle location, there's a bench, like a waiting area, and a TV. If you mentioned the bathroom already, so that's also in this waiting space. And then if you go towards the end, there's a full exam room with like the bed, the examination table. I don't want to say bed, right? the table. And it also has the sharps containers for safe needle disposal, the blood pressure cuff, and the little tips for your ear exam and things like that. And it's accessible, handicap accessible. It has the wheelchair ramp. So it's literally outfitted just as a standalone clinic would be.
And I Robin and I often talk on the show, as well as the producers. We talk about how Detroit has such issues in terms of mobility. Not many folks have cars or access to vehicles. We talk about public transit often as well, and lacking in public transit. So can you talk about how this will help vulnerable populations and communities who literally need medical services?
Sure. So in my role, I see a lot of things. I assist with the different law enforcement partnerships, with the court partnerships, school initiatives. And you will, like you said, hear people say how, well, I would, but I don't have a ride, or I'm not allowed to go on this type of transportation. And so if you go to a park and you just post up there, you will find people are interested. And when they learn that there's no cost to them, then they're more interested. And it's like, okay, here's an organization who cares about us, an organization who actually wants to support us with getting our wellness needs met. And so that's what we're trying to do, be more visible in communities, go to local apartments, organizations, businesses, and just show that we have a presence in Wayne County and we're here to serve the people.
Just to think about a mobile clinic being in an apartment parking lot where people can just come downstairs. I know so many people and have so many friends who don't have access to healthcare. So to have a mobile unit, knowing that they can at least get a physical or a checkup, would be just monumental for so many people. So the clinic is supposed to reach people every single Monday. How did you decide what neighborhood to set up the clinic, or how do you decide which neighborhood to go to?
With Wayne County being so large, we're attempting to hit every corner of Wayne County. So was it this week? So 2 days ago, we went to Van Buren. We know that that's a well-trafficked area. It's not, in Detroit, and we were attempting to go towards the, the edge of the county. Yeah. Next Monday, we'll go to the edge of the east side of Detroit. We'll hit Hamtramck. We'll go to the southwest. Just trying to hit certain hot spots. Residents have requested certain support, so we participated in an event, and some residents said, well, come to my park. I said, what's your park? No takebacks. So, so if you invite us, we will come.
Yeah, I love to hear that. So I'm thinking about the mobile clinic, of course. I'm thinking about neighborhoods and everything that you all are trying to offer within those neighborhoods. Can you talk to us a little bit about the things that you've heard, especially in your work when you are actually out within a mobile unit? I know this one is a newer mobile unit, but you've been able to traverse some of the other units that you all already have on the road. Can you talk about some of the things that you've heard from people who've used those services? Yeah,
a lot of people will talk about the burden that's been relieved, the fact that they didn't have to spend hours answering assessment questions, didn't have to miss work, didn't have to leave early and things like that. And that's the other pieces. We're trying to go beyond the conventional 9 to 5 or 8:30 to 4:30, making sure initially we're out until 6 p.m. at least, and then we'll expand, potentially till 8 p.m. But people are just relieved. And you know how sometimes people will say, we have this resource, meet us here.
Yeah.
Well, we're saying that, but we're also saying, invite us there. And so, yeah.
To the community groups who are listening right now, you can see that this the Wayne Mobile Unit will definitely come to wherever you are. All you have to do is just to reach out, which is, once again, really, really great to hear, a community-connected resource. But you already have the mobile mental health crisis services. How does this new clinic offer anything different from the mobile mental health crisis unit?
Yeah, so this is more preventative. So there's something we work with called the sequential intercept. I know that's, but the point is that intercept looks at when you hit crisis, when you transition to the next phase. We're trying to operate in the space before crisis. We want to connect with you to sustain wellness, to prevent crisis situations. But in case you do have a crisis situation, this unit will hand off to mobile crisis.
Yeah. And, can you talk about how this can help alleviate some of the stress on the medical system that we see within the hospitals, emergency centers, or even the urgent care centers that we'll see? Some of the procedures or checkups could be done with the mobile unit.
Yeah, so I'm assuming that if you go into a clinic and they tell you, oh no, it's a 30-minute wait, it's a 45-minute wait. I know I waited recently, I think it was like an hour and 30 minutes before I was called to the back to see what was going on. And so with this, we can at least get that initial check-in out of the way, right? We can do that initial, let me put eyes on you, and then see who we need to, connect you to. And it won't be a blind handoff. It will be a direct handoff.
Nice. We're talking about Detroit Wayne Integrated Health Network's newest outreach clinic. Our guest is Andrea Smith. She serves as the Director of Innovation and Community Engagement for DWIHN. Now, Andrea, how many people on average do you think will receive services from the clinic on Mondays?
I'm hopeful that we will have, at least a dozen each Monday. I know it doesn't sound like a large number, but it is a large number when you think of spending one-on-one time with people in a 2-hour period. Because we try to go to each spot. We're going to be here for 2 hours, go there for 2 hours. And so hopefully we can reach that mark where we see what our need will be, so we can determine if we need to increase staff to better support and serve.
And DWIHN has been expanding a lot of its services over the past year or so, including the mobile services and clinics that come to people's neighborhoods. How have you been able to reach more Wayne County residents by trying to meet people where they are instead of having them come to you? You talked about it a little bit, but talk about that importance there, if you can, there. Just that ability to have folks be in their neighborhoods and their communities and just come to you.
So some people might not appreciate this, but it to me could be like a delivery service. So it might sound like a DoorDash or something like that, right? And it's really, again, trying to remove barriers, alleviate that headache. A lot of stress comes from worrying about how you will reach care. So if you know you just have to walk outside, like you said, then that's a whole level of stress that's relieved. And so now it's just, okay, will I like these people that are providing this service? If you don't like the people providing the service, they can get you more people, right? So it's trying to introduce people to, here's what services look like. Here's what you should look forward to. Here's how to access care beyond this moment here. But if you prefer to remain with the external clinic, then we'll be back again.
And I'm thinking about just this new model you were talking about, like maybe like a DoorDash, but I think about back in the day, and I'm just saying back in the day.
Say it. Bookmobile.
I love the Bookmobile. We actually had Birdie's Bookmobile on not too long ago. She's one of the newer ones. Yeah, it's an amazing thing. And I love the mobile library as well. But I'm thinking about just traveling doctors in general. That's not a new thing to our society. I guess it's new to our generation of folks. But the traveling doctors was a thing.
It was.
So it just feels like we got traveling doctors back on the road.
I like how you said that. Yeah. Sounds better than DoorDash, huh? Yeah. So yeah, I think it's the same for traveling nurses, Yeah. So again, it's just coming into the community. We are community mental health. Right. So everything can't be within the walls. And so that's, again, where beyond the walls comes from.
And this is new model, once again, and how it's malleable and adaptable to those like myself, for example, who cannot get into the doctor's office at normal hours and would need to find another way. Just something quick, maybe blood test or anything like that. Just something small would be so beneficial for so many of us. So can we talk about in general our public services and how if they're getting better at assisting people who are struggling with mental health issues or even drug addiction? Have you seen a big push and effort to address those issues?
Yeah, with this specific unit, as you know, it just launched a week ago. So hopefully we will get to that point. But with our other services, I have seen more conversation around mental health, mental wellness, substance use prevention. I have noticed that we've been receiving additional invitations and requests to come out to schools, to come to faith-based entities and organizations to provide education and awareness. And so that is the main piece, is understanding that our name is, DWIHN Integrated Health Network. It doesn't mean that you are severely unwell, right? It just means you care about your wellness. You want to maintain that wellness, and more people are removing that stigma and accessing services.
And Andrea, we're going to be having a lot of conversations coming up soon about Movement Weekend. Can you talk about any involvement you all may have with Movement Weekend, party goers, or any of those folks who may tend to get a little happy during Movement Weekend?
Yeah, so that's interesting you said that. So we typically try to have a presence at different concerts and events. Yeah. We want you to know we're here. We're not going to party with you. We may bob our head a little bit, right? But we're not going to party with you, but we're here to provide that support. If you don't want to take it right now, then okay, at least take this mobile assessment, see if there's something you should look into when you've, left the fest.
Yeah, that's good to know. And my last thing before I let you go is to talk about some of the locations that people can find you. I know this weekend you're going to be somewhere in particular, and then as well Monday you're going to be in a new space.
Yeah, so DWIHN has a partnership with the Detroit Zoo. So tickets are discounted at $20, and we will be there this weekend. And on Monday, we will be at the Jeffersonian Apartments, Clark Park, and then you can catch us on the east side and in Highland Park.
Yes, right in my neighborhood, not too far from me. Okay. Andrea Smith is the Director of Innovation and Community Engagement for DWIHN. I want to say thank you so much for joining us on the Metro.
Thank you for having me.
From the WDET newsroom, the Coleman A. Young Recreation Center has reopened after millions of dollars in renovations. Upgrades include a new elevator, pool system enhancements, and electrical upgrades, to name a few. Drop-in programming for Coleman A. Young Recreation Center began this past Monday, and scheduled programming starts next week. There are now 13 recreation centers open across Detroit, and currently the Helen Moore Community Center is under construction in the Dexter Elmhurst neighborhood. Onwards to sports, the Tigers remain on a tear as they beat the Boston Red Sox for the second night in a row. Spencer Torkelson had a home run and Javier Baez had 2 home runs with a walk-off to end the game. They won 10-9. The last game of the series is tonight at Comerica Park. And the NBA playoffs are underway. Last night, the Indiana Pacers knocked off the Cleveland Cavaliers 114-105. They now wait for the winner between the New York Knicks and Celtics, who play tonight in Boston. Boston is without their star player, Jason Tatum, who tore his Achilles heel, and the Knicks lead the series 3-1. They could advance tonight. The Thunder beat the Nuggets 112-105 and now lead the series 3-2. Game 6 is tomorrow in Denver. And lastly, the Minnesota Timberwolves hope to end the series tonight against Golden State, who are without Steph Curry. Coming up, drug overdose fatalities have gone down in Dearborn. We'll hear about why next. This is the Metro. We will be right back.